India's health ministry has recorded the fewest new infections in a year and a half. Life in India has practically returned to normal. A few months ago, the country was still mired in COVID chaos. Now, the number of new infections is below 5,800 per day. Studies show that a great many of the 1.4 billion people in the country have already developed antibodies against the coronavirus. But that alone might not be enough to fight the pandemic, with new variants on the rise. Just over a third of the population there is fully vaccinated, far behind the level it needs to be to protect the population against a new wave of COVID. Welcome to your COVID-19 special. I'm Daniel Winter in Berlin. As the year draws to a close, India is attempting to ramp up its vaccination drive to meet the ambitious target of vaccinating all adults in the country. There's a long way to go. The government is doing all it can to encourage people to get both shots. But the numbers show that millions who are eligible for their second dose have not come back to get it. DW's Namisha Jaiswal and Sharik Ahmad travelled to Haryana in northern India to find out more.
Rajbala knows everyone in her village. This especially comes in handy for her as a public health worker. Every day, she walks through the village calling out people's names who haven't taken the coronavirus vaccine yet, pressing them to come to the village center. Many here don't keep note of when they are due for their second dose, so she gives them a stern reminder on their doorstep. But for some, it hasn't worked. 23-year-old Tanya says she's too busy with housework and her infant daughter. But on further probing, she admits that she's scared of getting a fever and body aches again. The nurse is more sympathetic to Tanya's mother's reasons.
I can't walk from here to there. They help me up, even to go to the bathroom. How will I go? I can't breathe very well either.
Rajbala promises to return to the house to give the elderly woman her second dose. The challenges Rajbala faces are not unique. The Indian government found in October that over 100 million people were overdue for their second dose. She has heard every reason for skipping full vaccination. Worry about fevers and apathy fueled by low case numbers are among the most common. The nurse has found her way around it. When the carrot doesn't work, she says, the stick does.
People have been told that they cannot access their pensions, banks, or their children's schools if they aren't fully vaccinated. We've told the shops distributing food rations that they should only dispense them to those with their second shot.
These unofficial mandates are reportedly used across the country, as health workers are pressed to meet a tight and ambitious deadline. India aims to vaccinate its entire adult population by the end of this year. With the emergence of the Omicron variant, the government is now emphasizing on overcoming second dose hesitancy. Experts here say that complete vaccinations will be crucial to fighting off a third wave and building towards herd immunity against COVID-19.
Whenever there's a new mutant which comes up, there's always a sort of a threat which looms around that the cases might go up and there will be a wave. Given what we've seen in the past with the devastation that the second wave did in India, lots of people lost their lives. We need to be very, very, very vigilant and aggressive with vaccination.
Rajbala says she is aggressive for a reason. She lost her younger brother in India's second wave earlier this year. Her appeal to fellow villagers, through both pleas and threats, is to prevent a similar tragedy in their homes by getting the vaccine.
And for some expert insight, let's speak with Professor and epidemiologist Rajib Dasgupta. Thank you very much for joining us, by the way. About 37% of Indians are fully vaccinated. Why is the figure so low?
Thank you. The coverage with the first dose is now at an average of about 90% across the country. And this has taken quite a number of months, as we know. The second dose, as the report said, is indeed facing some issues of complacency given the falling numbers in new cases and therefore perhaps the risk perception being at its lowest ever in its last 1.5 years. And the other thing to factor in with that is nearly 30 million women less vaccinated than men, and those are primarily young women with pregnancy or those who are in lactation. And initially there was an advisory against that, but even though that advisory has changed, the perceptions have remained very strong in this group against these young women, young mothers, not vaccinating.
Okay, and you mentioned that quite a lot of people, certainly a lot more than have the second dose, have at least one. How well or how poorly protected are these people against a COVID infection?
I think we need to read this data, which is the vaccine coverage data, along with the seropositivity data, which is a combination of natural exposure to natural infection plus vaccinated. And that is 90% plus in almost all states, barring a few which actually had better control in the initial stages. So the overall protection would be determined by a combination of these two factors, and possibly, I'm just saying possibly, the Omicron not spreading so fast. And one report from today, Karnataka, points to the state, particularly the city of Bangalore, testing quite widely for the spread of transmission of Omicron, but not really coming up with evidence to show that it is spreading widely, even after its introduction.
And so you mentioned Omicron there. Is India prepared for a potential new wave of COVID?
In terms of clinical care, certainly all states and districts are geared up. I myself am not in Delhi. I'm in an eastern state now, in a relatively underprivileged district, looking at vaccination issues, both COVID and non-COVID. But yes, there is certainly an element of preparation, which is a lot better than what it was that we saw in the first and the second waves.
And just briefly, what lessons have national and state governments learned from May, when there was a massive spike in cases? Because you mentioned that some things have been learned. What are those?
Well, very briefly, those are three. One, clinical care has been beefed up a lot. Second, surveillance mechanisms, those have been streamlined a lot, drawing upon experiences of polio, measles, eradication, elimination programs. And third, a fair degree of social mobilization, but communication around vaccination certainly needs to be a lot more nuanced than where we are now.
All right. Well, thank you very much for your insights there. That's helped us to understand the subject in a lot more detail. Rajib Dasgupta, thank you so much.
Thank you.
And now it's your turn to ask a question. Today, one viewer wants to know about the evolution of the coronavirus. The man to answer it, our science correspondent, Derek Williams.
Isn't it in a virus's best interests if its host don't die? So shouldn't a virus naturally evolve into less deadly forms?
Well, as my father used to say, woulda, shoulda, coulda. It seems somehow to make sense for a pathogen to evolve over time into a less deadly form, right? Because if a disease kills its host, especially if it kills that host fast, then it's reducing its own chances of being passed on. So especially less deadly, more transmissible variants should have some clear evolutionary advantages and start outperforming more deadly ones, right? That logic is so convincing that scientists kind of took it as a given for a long time. But the problem is, there are pathogens where that hasn't happened. Like, for instance, the bacteria that cause tuberculosis and syphilis, just to name two. They've been infecting humans for hundreds of years, in the case of TB for thousands of years. But both continue to kill large numbers of people today. In fact, according to the WHO, tuberculosis was the second most deadly infectious disease worldwide in 2020. it was only beaten out by, you guessed it, COVID-19. So obviously, other factors can influence the evolutionary directions that pathogens take. And from our perspective, trying to define what's good for one is pretty tricky. Virulence, for example, under some circumstances, could also be viewed as an advantage because the sicker the host grows from a pathogen, the more likely they are to shed more of it and give it to someone else. In fact, current ideas theorize that there's actually quite a bit of evolutionary trade-off between transmissibility and virulence. And other factors like how long a pathogen can remain viable outside a host, they complicate matters even more, making forecasts about future versions of SARS-CoV-2 causing generally milder symptoms even more tenuous. It'd be great if that happened, of course, but it's not a foregone conclusion.
Derek Williams there. And finally, kids in Germany can get their COVID-19 vaccinations for the first time starting this week. Last week, the German Standing Commission on Vaccination recommended coronavirus jabs for children between 5 and 11 years of age with certain pre-existing conditions. The experts also recommended a jab for kids if they live with someone at heightened risk who can't get the vaccine themselves. For all other children, getting the vaccination should merely be a matter of personal preference. And that's it for the COVID-19 special. I'm Daniel Winter in Berlin. From me and the whole team, stay healthy, stay safe, and see you again soon.